into gym. And what's the big deal about gym? They're just playing around. Well, what ended up happening was he went into the gym class because he thought he could, and got hit by a basketball. Big basketball in his face. Hit his head, got so much worse with dizziness, headache, nausea, went to the nurse, and was out for a couple of weeks from that simple thing. Yeah, if you think about it, it could happen to any kid, right? Well, this is an elite hockey player. He's 14 years old, who at high level team, who's used to, you know, for those of you who play hockey, you see how fast they move, how excellent their hand-eye coordination is. So he's used to stick handling on a stick 3 feet away, seeing a puck this small, that far away. And whipping around. That's how capable he is. And you can imagine how impaired he was to not be able to see a basketball this size coming to his face and turning his head looking up. That's how impaired he was. And he was worse. So that's just one example. So if you get hit again, you're more likely to have a prolonged recovery. There's also cumulative effects with multiple concussions. We know that those people would have several concussions would take longer to recover. And then of course the risk for second impact syndrome. Unfortunately, we have the acute injury, but we still don't know how long that period of vulnerability is between that time. And then the long-term complications, obviously there's post-concussion syndrome. About 15% of kids or people will have symptoms ongoing for 3 months, and then you can have mild cognitive impairment and depression later on. Also with children, there's long recovery in children. These are just some of the references, but which I'll go through pretty quickly. You can get them at the end. But in one study, the overall mean duration, this is out of Boston Children's, the overall mean duration of symptoms was 43 days. That's 6 weeks. Okay, so it's not the typical, just keep in mind, it's not the typical 7 to 10 days of recovery that you're all used to for adults. It's much longer in kids. Another, this is out of, oh, maybe that was out of CHOP. So this one was out of Boston Children's. 1 month after injury, nearly a quarter of children still complained of headache. This is a quarter. So greater than 20% suffered from fatigue, and nearly 20% reported taking longer to think. This is 1 month later after injury. So it's a significant number. Time interval between concussions and symptom duration. History of a previous concussion within 1 year. So if they had a concussion within 1 year or multiple concussions, their risk factor was also longer for recovery. So we're talking about longer recovery, we're talking more than a month. Okay, so keep that in mind. And then more recently, in the Journal of Neurosurgery, where they looked at, this is out of UPMC, where they see like 1,000 concussions a year, they re-examined the recovery curves following sport-related motion, looking at vision, looking at balance, looking at dizziness, and using the recommended comprehensive approach for assessment of recovery time for sports-related concussion is 3 to 4 weeks, which is longer than commonly reported for 7 to 10 days. These are adolescents. These are kids. Okay. So when you see them, they're going to have a significant time in school for much longer than you suspect. But you want to keep them out of your ER. So it's really the time that you have to see them is when you're going to tell them what they need to know so that they don't come back. Because they're going to come back in a week and say, I still have a headache. Can I get my CAT scan now? Which we know is not necessary. I have plenty of stories I'm going to talk about. And also females. Females take longer to recover and symptom means than males. So we'll skip this. This is what I talked about is the duration, of course. Mean duration of symptoms was the longest for irritability, 16 days, sleep disturbance, 16 days, frustration, 14 days, and poor concentration, 14 days. 1 month after injury, nearly 30 children still complained of headache. And greater than 20% of fatigue, and more than 20% reported longer than so we know kids are at risk for prolonged recovery. Who else is at risk for prolonged recovery? So kids, which we talked about, so versus adults, and adolescents, which I'm including in that. Migraine history of symptoms, there's a migraine history, or if there's a history of migraines in the parents, they're at a longer risk for recovery. They have the same genes, let's put it that way. Any history of learning disability, ADHD, gender, females are more at risk for longer recovery. UPMC also did this other study where they looked at symptoms. Is there certain symptoms that occur at the time of injury that can predict who are the ones that are going to take longer to recover more than a month? And what they found was it's symptoms of dizziness and fogginess. So if somebody comes into your ER and they're saying, oh yeah, I feel fogginess, and I'll talk about what fogginess is, or dizzy, keep an antenna up, and you're going to tell like the person, okay, this is not the person that's going to be getting better in a week. It may take longer. So then what do you do? Okay? And history of motion sensitivity and ocular dysfunction. This is a big one. This is all about vestibular function, and we'll talk about that. I can't tell How many kids? Anybody get car sick, by the way? Raise your hand if you get car sick. Okay, so we'll avoid the one test that we're going to do later that may make you throw up in the seat. So, but what people with car sickness, they get much more car sick after a concussion. They cannot stand car rides, and it's related to the vestibular dysfunction that happens with head injuries. Okay, so this is what I kind of want to spend a little bit more time on, and sorry for all my hockey references, but I'm from a family of hockey players. So you get it in the head. This used to be the old sideline. Sideline evaluation. How many fingers am I holding up to? Okay, you're fine. You can go back into play. Not okay. And one of the things I do is sideline evaluation. So I'll talk about that also as well. But it's for these patients, it's going to be easy enough for you guys to diagnose a concussion because they got hit in the head. This is a kid that does not need a CAT scan. He's got a little bit of headache and dizziness. Okay. Do the evaluation and then send them out the door. What you need to keep in mind though is for the kids where it's a couple of days later and they're coming in because of a complaint of dizziness and headache or something else, and which we'll go into, and they don't know if they got hit or the parent doesn't know if they got hit. That's when you really need to ask the kid what's going on, and we'll go through some of that. And most of it, all this diagnosis can be made with history and physical exam. So some of the cases, these are actual cases. An 11-year-old girl woke up with significant headache, stomach ache, sore throat, and low fever. 8-year-old boy smiling and active with dizziness and stomach ache. Okay, no known history of trauma for either one of those cases. Let's just put it that way. From the parents, okay, parent referral. Because what happens, with anybody have kids? How old are your kids?
7 and 2.
Oh, so your kids are a little younger. Anybody have older kids? Like
9 and 6.
9 and 6. And then do they ever fall down and hurt themselves and then like 3 days later they're complaining about like, oh, my ankle hurts, take me to the doctor? Yeah, that happens all the time. So they may not know about it until the symptoms develop, okay? So it's all about you eliciting that history. 10-year-old playful boy with developmental delay and behavioral problems brought in by a dad for not acting right after a fall, okay? Now this I'm a little, this is an interesting one because I was the 4th doctor who saw this kid before he was given a diagnosis of concussion. The 4th doctor. You should be the 1st. Thanks. And this came to our ER, to LJ, and we'll go on. So keep in mind with children. Children are poor communicators, as we talked about. Not only do they not know, they can't elicit cause and effect. Like I hit myself, he may not have had symptoms at that time, but then it developed. But they also cannot verbalize it. They don't have the language to verbalize what they're feeling. They may feel a little headache, a little confusion, blurry vision, sickness, but they don't know how to describe it. A lot of times kids will say, I feel my stomach hurts. Well, it's not because they have stomach pain, it's they feel nauseous. And for them, anything relating to the stomach is pain. They listen as pain. A lot of times I say I feel weird. I hear words, I feel weird. So just remember when you're talking to these kids, they're not giving you the answer. They're not going to give you the answers that you want to hear. You have to actually pull it out from them. And we'll go through it. So you may have seen this slide, seen a similar slide from your concussion talk a couple weeks ago. Keep in mind that concussion is a global brain injury. So that you could have anything from physical complaints, so headache, nausea, vomiting, balance problems, dizziness, visual problems, sensitive to light, sensitive to noise. Those are the typical ones that we are aware of. But there's also cognitive, emotional, and sleep disruption that occurs with concussion. So difficulty to remember, difficulty concentrating, that feeling of mental fogginess. The way people kind of describe fogginess is and what I ask the kids, because they're like, fogginess, what is that? So so what I say is, if you ever swim and you open up your eyes and you feel like everything is not clear, so it's almost a visual fogginess that they have, that's kind of what fogginess feels like. So you open up your eyes and everything is just not as clear or as clear as you're used to. Or if you walk into, if you've seen smoke, and you feel like you're walking around into smoke. It's very hard for kids to verbalize it. There was a physician, one of our physicians, who had concussions as a college soccer player, elite soccer player, and she had this fogginess for months, and it really felt like they were going crazy. She was going crazy, and she didn't know what it was, and here she was a physician. So back then, people didn't know about concussions and what other cognitive and emotional issues you can have back then, but now we do. So when people come describing these weird things that don't make sense, just keep it in the back of your mind. And so she never actually got the help and then eventually resolved. But she felt like she was going crazy. It's like she woke up and her brain was not clear. It was not fogged. And she's fine, obviously. But emotional sadness, drowsiness, they all have sleep issues. So headaches are the most common symptom. Keep in mind loss of consciousness. I think you guys all know this. It occurs in less than 10%. That's rarely happens. In fact, that may be one of your signs or symptoms to scan a kid, and that's in that PCAR. If you look at the PCAR guidelines, they talk about loss of consciousness. But if you're anywhere and there's any loss of consciousness, and more than, and they say more than like 30 minutes, but we obviously are going to examine that kid, that really happens, and you should think of other reasons.
I have a question.
Mm-hmm.
When you talk about dizziness, it seems like everybody's like, oh, I got hit and I was dizzy for a second. Is there do you quantify like dizziness right as it happened versus 5 minutes later versus an hour later?
Sure. So dizziness, and that's when they talk about the protracted memory, they don't talk about how long did that dizziness last. And part of the issue too is that the dizziness can get better, but when they do certain activities, and I'll talk about that, the dizziness comes back. So like banging down, the dizziness gets worse. Reaching up to like put something in the cabinet, it's when they get home that the dizziness gets worse. So there's no quantifiable. It's about exertions, or dizziness when you get out of bed in the morning. That's when the kids, and that's one of the things I'll talk about is what is making their dizziness worse. So if it's activities of daily living, that's probably, and there was a traumatic event prior to that, it's probably the concussion. But you know, in terms of when, we don't know. But that's a vestibular issue. And a lot of times kids actually have visual disturbance and sensitivity to light. Like every kid has visual sensitivity to light. So in terms of the clinical interview, it's not about how are you feeling, because you're going to ask a kid, oh, so how are you doing? And you get this typical, I'm fine. I get that with all my kids. So what you have to do is explain, well, you have to ask, okay, well, tell me what you're feeling. Or sometimes they just need words. Does your head hurt? Does your belly hurt? Sometimes they need very specific points. But it's like, does your pressure in the head increases as the day progresses? I had one kid who, one of his symptoms was like he would, and this is a kid that had an incidental, was playing around with his brother at home, flipped over the back of the sofa, hit his head, cried, had a headache, was fine, and went to school the next day, was fine in school, but noticed that as he was walking down the hall, he turned his head, he got dizzy. We're talking about dizziness. So he walked down the hall and turned dizzy. I was like, what is that? Like, does your head hurt? A little bit, but it was the eyes turning and walking down the hall and turning dizzy. So walking down the hall, turning his head really quickly, and getting dizzy. So you got to find out about what it is. With headaches, typically with concussion, they usually get worse at the end of the day because they don't have the mental stamina to get through the work day. So whether it's the school day or the work day, they don't have the energy to be able to get through the day. Do busy environments cause you to feel foggy, anxious, or tired? Do you become dizzy when looking up, turning your head, standing quickly? Do you have blurred or fuzzy vision while reading or difficulty reading? And a lot of people have issues reading. Do you feel frontal pressure in your head when reading a computer? So you got to kind of elicit, like, what activities are making you focus? Okay. Do you feel more distractible? This is all from UPMC from Pittsburgh, all these questions. Do you have difficulty watching film or reading the playbook, falling or staying asleep? I'm going to go to the next slide. Yeah, I'm going to the next slide because this kind of elicits what I'm talking about. So this 11-year-old girl, it sounds like any other, if you're working in fast track, 11-year-old girl comes in with a significant headache. That's her biggest complaint. Stomach ache, feels a little nauseous, sore throat, and no fever. Anybody want to ask any other questions? You do a strep's negative. The throat's not impressive.
Any trauma?
So, yeah, because we're doing a concussion talk, you kind of have to ask trauma. And the mom says, like, no. But the girl's like, well, wait a minute. So this is when you have to ask the kid and not the parent. So with this child, when you see it, you think, oh, it's another sore throat, we're going to do the strep. But the difference here, and this is when you got to keep your physical diagnosis skills intact, or your as a physician. The headache was actually out of proportion to the sore throat, and there was no fever. So remember, if you think about strep, the kids are miserable. Yes, they have headache and nauseous, but they usually have a fever when they have that headache. They feel miserable. There was no fever, no running, no URI type symptoms at all, but the headache was what was bothering this kid. So you ask about dizziness. Yes, I actually am dizzy because someone asked the question. But yeah, I was feeling a little dizzy. Yeah, I was feeling a little nauseous. And then the question came out, did you hit your head? And the kid sits there and says, actually, yes. Okay? So light bulb on. It was 3 days ago in the last 3.2 seconds, she's a hockey player, okay? 3.2 seconds of the game against the Little Flyers, I was up against the boards, 3 guys were coming down on me, I had the puck, I saw one guy fall into the next guy, it was a domino effect, and then the last guy hit into me and I hit my head into the boards. Very detailed. So the thing about these kids is, one, the parent didn't know, okay? You know, and didn't know about it, because the kid just kind of hit the head, felt fine, and then kept playing. And in fact, she played another game later that day and actually got 2 goals. Who knew? It was over the course, so she remembered the event, but she didn't have any significant symptoms, and the symptoms developed over the next couple of days. So the thing about these kids is, if it's a concussion, if you think about hockey, going back to hockey or football, kids fall down 10 times a day, 100 times a day. Now they get hit 10 times a day. But they know that one incident that is worse than the others, that makes them feel different, that makes them feel awful. She knew the exact time when it happened. I get a lot of hockey players because they always, they can tell me it's 20 seconds into the second period or it's 30 seconds because they're always looking at the clock. But they know the one hit that was different from others. And then I asked this kid, so, you know, you've been in school for the last couple of days. Did anything in school make you feel any different, or did you feel weird? Because this kid looks pretty good. She's, you know, talking to you, she's interacting. And she says, well, actually, yes, and I love girls because they are more verbal than boys. Boys, it's the shrug of the shoulders, you know? And so she says, yes, actually, and they had gone to a hockey practice. When I was at hockey, I asked about stick handling and all that. When I was at hockey, the coach was doing a play, the X's and O's on the board, and she had to repeat that drill onto the ice about where to go, and she couldn't remember what that drill was. She couldn't remember, so that's visual memory. He was drawing out the X's and O's on that board, okay? So that's visual, just keep in mind when you hear this, because we're gonna talk about visual memory. She couldn't remember, and then she got back on the ice and then had to keep going back. I said, okay, so what about school? Did anything happen? He said, well, you know what? I said, were there any subjects or any classes that you kind of, because kids with concussion, there's certain classes that actually make them feel worse than others. And she said, actually, social studies. I said, okay, well, what about social studies? And she says, and this is classic. So if you always ask the question. I was taking notes from the smartboard. Once they hit, say smartboard, everybody knows what smartboard is, right? Once they say smartboard with Rotterdam, it's clearly veterans right there. It's concussion related. So I was taking notes from a smartboard. I was reading across like you're reading now, and I couldn't remember the words when I would write the notes. And I kept looking up and I kept looking down. I couldn't remember the words. So memory, she was having difficulty tracking. So that's tracking, reading across, and looking up and looking down was making her worse, as well as the memory piece of it. So that was off. Light bulbs are going off. Okay. 8-year-old boy with dizziness, and we'll talk about the exam. So 8-year-old boy with dizziness and stomach ache. So this is another kid that came into the ER, and you know, you're sitting in fast track, and you say, dizziness, what is this? That should be in the acute area. That's like a major workup, right, for neurology. You're going to get neurology, you have to do the CAT scan. So, and the kid's sitting there, he's playing, he's reading, whatever, he looks pretty good. And so you ask the history of what's going on, any cough, cold, sore throat, blah, blah, blah. And it turns out, well, Mom, when did he start? When did he start? Here, when did the dizziness begin and what were you doing? So the mom explains, well, the dizziness really started over the weekend. She had a lot of work to do at home, so she put him in front of his, he was working a lot on his iPad, the iPad. So she noticed that he was on his iPad for much longer than normal. Okay, so he asked the mom, did he hit his head before? No. So you turn to the kid, did you hit you? Did you fall down or whatever? He said, yeah, on Friday, I was in gym class, and this kid pushed me down and I hit my head, you know. And the mom's like, you didn't tell me that. So no, of course, it was a couple of days later that one, the symptoms developed, and two, it's the iPad. It's the dizziness got provoked and got worsened. And then I put this kid through the exam, which we'll go through, and he had all the classic signs. But then once you continue to do it, they get more tired, more dizzy, more exhausted. You're recreating their symptoms. So then it makes it very easy to say, this is a concussion, you can go home, follow up with your doctor. And then you avoid that whole major mega workup. So what happened with this boy? 10-year-old playful boy with developmental delay and behavioral problems brought in by dad for not acting right after a fall. So this kiddo, there was a clear-cut history of a fall in school. Was playing in gym class, got hit, got knocked down, everybody saw it, and he just was woozy as he was sitting. Like I said, I was the fourth doctor. So appropriately, the school called the parents. The parents called the pediatrician. The pediatrician said, oh, you got a head injury, go to the ER. No, actually went to the pediatrician's office. Sorry, I take it back, because that was the first doctor. Went to the pediatrician's office, appropriate. Parents are totally appropriate. Pediatrician said, oh, you got a head injury, you might need a CAT scan, go to the ER. Okay, went to Cohen's Children's ER. So our doctor saw them, physical exam, the general neurological exam was fine. And he's sitting there, he's talking, he's kind of laughing. Yeah, fine, he looks pretty good. And so the mom brought him in, parents are divorced. Now when you get divorced parents, you get totally different stories. So the mom brought him in and said, yeah, he has behavioral problems, he's just not acting himself, but this is always him. So the mom was continuing it. Yeah, he's totally fine. But he wasn't making sense. Like he would say some things that just didn't, hey, what's going on over there? And just wasn't making sense. But he was developmentally delayed, there was behavioral problems, so they kind of moved it. And so but one thing that they did notice, that they did say was that one of the teachers said he was seeing, they thought he might have had visual hallucinations. Because at the time at the school, he was talking to people that weren't there, right? So now he's not acting right, he's got visual hallucinations, and he has a history of behavioral problems.